Alberta Health Services wants all Albertans to live the longest and healthiest life possible. Strategic clinical networks will have a direct impact on patient care by leading us in creating the best performing, publicly funded health system in Canada. The Emergency Clinical Network is working with physicians, managers, clinicians, and educators to ensure timely, accessible quality of care for all Albertans. The sharing of best practices and maintaining a high standard for accreditation are just some of the priorities for the Emergency Clinical Network. In fact, the first provincial emergency accreditation ever done by Accreditation Canada was done in Alberta.
Accreditation is part of the quality improvement process, and as part of that quality improvement process, accreditation gives us an opportunity to compare standards across Canada and to see how we are meeting those standards compared to other facilities in the country.
Historically, accreditation was done once a year. It was a time-consuming process and required a massive amount of paperwork and was done mostly at the management level. Now, with the Emergency Clinical Network, everyone is involved in the process. It's more efficient and is an ongoing process.
We then every day look at quality assurance differently because of accreditation. We see that we need to be meeting standards and that those standards are things that we strive for not one day of the year but throughout every day.
I think the network helped lead that process. If we wouldn't have had that conduit, we would not have been able to come together in that kind of manner.
Accreditation is only one of the many initiatives of the Emergency Clinical Network. Education and clinical pathways are also top priorities.
In emergency, the educator piece is very large because our educators work together at creating content for education. And that can be a very time-consuming process, and in doing it once with many people, there's an economy to that.
The second piece is to have some clinical pathways that are going to be consistent across the province. So if you have asthma and you walk into an emergency department, you'll follow the same clinical pathway no matter where you are in the province.
Clinical pathways create efficiencies and support for the frontline staff.
And that the medical staff understand that this is the best practices and has been researched, and so by creating those clinical pathways, we've done our research and we know that this is the best way to treat that type of patient.
It also gave me support as a manager. I actually call other managers now that I've met through the clinical network that, for instance, a manager in Red Deer, she'll call me any day now and say, can you show me what form you're using for this or what's going on with this? If somebody's done something once and they've done it well, it's really nice to walk in and say, do you mind if we adopt this? And people are happy, they're proud to share their learnings.
The network was more of a facilitator. The network helped to facilitate that all the contacts came together, that we got to meet, that we were able to do this as a province, where previously without the network we were very zone-based and very site-based.
I think there'll be more work done really on with our education and our educators as we go forward. I see as managers that there'll be more connection with different managers throughout the province. And I think that even at the physician level, our physicians will start looking at adopting more clinical pathways for sure.